مساء الخير، أهلا بكم في محاضرة هذا المساء، وهي حصاد عام 2024. بداية نأخذ ما تم إقراره من مؤسسة الغذاء والدواء الأمريكية. أولها زانوميلين and trospium chloride for schizophrenia in adults. وكان من الواضح بإقرار هذا العلاج بأننا نخطو خطوة في اتجاه مختلف، فهذا من الأدوية التي تعمل على الcholinergic system. The effectiveness was demonstrated in 2 5-week randomized double-blind placebo-controlled studies involving adults diagnosed with schizophrenia. Participants who received Cobenfy هو بما إنه combination فهو اسمه Cobenfy showed significant reduction in symptoms compared to the placebo group as measured by PANSS. The medication comes with several warnings and potential side effects, including urinary retention, increased heart rate, and liver damage risk. هذه الورنينجز اللي وردت فيه. FDA emphasized that Cobenfy should not be prescribed to patients with certain pre-existing conditions such as moderate to severe kidney or liver disease. فيعني احنا خطوة للأمام، لكن واضح انه هي مش دواء سحري. Neurostar advanced therapy TMS as adjunct treatment for MDD in adolescent. هذه خطوة مهمة في TMS بأنهم أضافوا. طبعا دائما FDA عندما تقر جهاز لشركة معينة ولا تقره بشكل عام، وهذه بيصير عليها بعض يعني مرات بعض النقاش، يعني إذا كان المفروض هي تقر بمواصفات معينة، لكن دائما يقروا باسم نيوروستار اللي هي أكبر شركة أمريكية. هناك شركات ألمانية وكورية وغيرها تصنع أجهزة TMS. This clearance makes Neurostar the first one and only transcranial magnetic stimulation treatment FDA cleared for this age group, making its fourth FDA clearance indication. أيضا صار في approval ريسبريدون ريسفان ISM for schizophrenia. approved ريسفان واللي هو ريسبريدول ISMR developed by إحدى الشركات لعلاج السكيزوفرينيا in adults. This prolonged release injectable antipsychotic provides immediate and sustained drug release from the first injection without requiring doses or oral supplementation. كما تذكروا بأنه ريسبريدون كونست سابقا كان يتطلب supplementation دور الريسبريدون and برضو كان يشتغل every 2 weeks. Approval was based on PRISMA 3 study 2, which demonstrated significant improvement in schizophrenia symptoms with both 75 and 100 milligram monthly doses compared to placebo. The treatment showed rapid onset of effectiveness, which with improvement observed as early as 8 days after the first injection. Long-term studies indicated that risperidone was effective, safe, and well-tolerated with potential benefit for patients' functioning and quality of life. Another new approval, which is not a drug, which is Rejoin. April 24, the FDA cleared Rejoin, a prescription digital therapeutic developed by Otsuka Pharmaceutical and Click Therapeutics for adjunctive treatment of major depressive disorder symptoms in adults age 22 and older who are on antidepressant medication. يعني بمعنى أنه هذا تطبيق على السمارت فون 6-week smartphone app-based program that uses cognitive emotional training and exercise therapeutic lessons to enhance cognitive control over emotion. The FDA clearance was based on MIRAI study, which is 13-week randomized double-blind sham-controlled trial involving 386 مريض. As the first prescription digital therapeutic authorized for MDD symptom, rejoin represent a novel approach to depression treatment targeting neural networks affected by the condition, and it is expected to be available for download in later half of 2024. طبعا هذه يمكن تكون بداية لمجموعة من الابليكيشن اللي المريض ممكن ينزلها على الهواتف وتساعد في العلاج النفسي. أيضا من الأشياء اللي تفتح يعني الصدر وتشرح الصدر هو إقرار زونفيل which is benzgalantamine delayed release tablet for Alzheimer. Approval of donanemab azib for the treatment of early symptoms of Alzheimer disease targeting adults with mild cognitive impairment or mild dementia stated confirmed by amyloid pathology. Kisunula is notable for being the first treatment that allows therapy to be discontinued once amyloid plaques are cleared, potentially reducing treatment costs and frequency of infusion. فهو intravenous يؤخذ حتى نكون تغلبنا على الأميلويد بليكس وممكن إيقافه. The approval followed the Trailblazer ALZ2 phase 3 study 4, which demonstrated that kisunula significantly shows cognitive and functional decline, with those less advanced and their disease showing 35% reduction in decline compared to placebo. However, the treatment carries risks such as amyloid-related imaging abnormality area, which can lead to brain swelling and bleeding. Despite these risks, this approval is seen as significant. The expectation that we will be able to see more and more treatment that is working on the amyloid, on the pathology of Alzheimer, and can treat Alzheimer early, even before it's symptomatic, by positron emission tomography. As you know, we can detect Alzheimer as early as 20 years before its clinical manifestation. And having a treatment that works on amyloid deposits and tau and tangles and so on will mean that we are modifying the pathology, and it's becoming worth it to diagnose early, 20 years early, Alzheimer's disease. And now, if I tell somebody I will do this to discover that you may get Alzheimer in 20 years, what I can give him? He could kill himself. أيضا another approval, which is clonidine hydrochloride extended release. كلونيدين كما بتعرفوا هو مستعمل بالسابق، لكن ما كانش مقر، وبالآن extended release, which is once daily treatment for attention deficit hyperactivity disorder in pediatric patients aged 6 years and older. The medication can be used as monotherapy or as adjunctive therapy alongside approved central nervous system stimulant medication. So it can be combined with stimulant because this works on adrenergic. I don't know. It's an adrenergic drug. Notably, it is the first liquid non-stimulant ADHD medication approved in the United States and the only one with nighttime dosing. غالبا تعرفوا كلها الأدوية صباحا وكلها النون ستيمولانت بتيجي يعني ستراتيرا بيجي على شكل أقراص حتى للأطفال. هذا بيجي على شكل سائل كان يعطى بالليل وممكن يعطى على عمر 6 سنوات. The approval is based on a study that demonstrated the efficacy of clonidine hydrochloride extended release in reducing ADHD symptoms. It provides important internal alternative to patients who do not respond well to stimulant or experience side effects. Another important approval is erzo-free, which is paliperidone palmitate extended release injectable solution for schizophrenia and schizoaffective. The FDA approved this paliperidone palmitate extended release suspension for treating schizophrenia and schizoaffective disorder in adults. Marks the first time a patent paliperidone palmitate long-acting injection developed in China, which is يعني this is another good news. يعني زي ما الصين دخلت على صناعات كثيرة هي الآن تدخل على هذا الخط it's administered monthly and designed to improve medication adherence by reducing the frequency of dosing compared to oral antipsychotic. Clinical studies demonstrated the bioequivalent of the existing Invega Sustaina with an optimal initial dosing regimen that enhanced patient compliance. The most common adverse event reaction observed were injection site reaction, somnolence, dizziness, akathisia, and extrapyramidal disorder. يعني بلغة أخرى هذا أول long acting injection مساوي للإنفيجا سستينا approved by manufactured in China. Hopefully it will make the price less. في عنا أيضا بعض extended approval لل FDA. It means that the drugs were approved, but there has been extra additions to this drug. Iloperidone, FDA expanded the approval of iloperidone to include the acute treatment of manic and mixed episode associated with bipolar 1 in adults, in addition to its existing indication for schizophrenia. طبعا هذا مشابه لكثير من الانتيسايكوتيك إنها بالبداية approved for schizophrenia. Later on, other indications start coming up. The approval was based on phase 3 study showing that patients treated with iloperidone had significantly larger improvement in young mania rating scale compared to placebo, with safety profile consistent with the previous trials in patients with schizophrenia. The new indication provides patients and healthcare providers with an additional treatment option for managing bipolar disorder 1. Another يعني توسع أيضا فيما يسمى بيتولوسانت WAC 6. FDA approved waxes to treat excessive daytime sleep in pediatric patients aged 6 years and older with narcolepsy. This expanded approval was based on randomized double-blind placebo-controlled phase 3 study that demonstrated statistically significant improvement in pediatric daytime sleeping scale total score for patients with pitolisant compared to placebo. The most common adverse reaction were headache and insomnia. هلا ننتقل لجزء ثالث واللي هي بعض النتائج الدراسات المهمة. طبعا هناك دراسات كثيرة مهمة، لكن أنا يعني اللي شفتهم لفتوا الانتباه. هذه هي المقصود بها. أن blood test could streamline Alzheimer treatment decision. هلا لحد الآن إحنا مشكلتنا في الألزهايمر إنه ما عندنا إلا السبكت والبوزيترون emission tomography إنها to discover it early, which is not widely available, and but it needs a lot of data to be like a bank, data bank, where the machine could compare the image. Blood test biomarker have shown promising results in recent research, offering the potential for less invasive and more accessible diagnostic tool. These advances could significantly improve early detection and monitoring of the disease. A study published in JAMA Journal Neurology in January 2024 evaluated the use of plasma biomarker, particularly phosphorylated tau 217 بتختصر p-tau 217 to identify patients with Alzheimer's disease who are most likely to benefit from anti-amyloid immunotherapy. The researchers analyzed data from 912 participants with cognitive concern and found that plasma p-tau 217 was highly effective in identifying amyloid beta positively and differentiating between low, intermediate, and high tau PET load among AB positive participants. Blood test using two-cut point strategy, only 17% of participants required confirmatory cerebrospinal fluid or positron emission tomography PET testing that determine AP amyloid beta status. Additionally, this approach could be potentially reduce the need for tau PET scan by 56 or 57% when identifying high tau PET among amyloid beta positive participants. This finding suggests that plasma p-tau 217 measures can substantially reduce the number of invasive and costly confirmatory tests required to identify individuals who would be likely benefit from anti-amyloid therapies, potentially leading to cost saving of 60 to 70% compared to conventional workflows. Another interesting study about antidepressants that are linked to increased risk of impulse control disorder in Parkinson's disease. And I'm sure you are all facing the problems with Parkinson's disease. They come with anxiety and depression, and it's not uncommon that you prescribe antidepressant. What's the point? That impulse control disorder are significant concern for patients with Parkinson's disease, affecting their quality of life and treatment outcome. While dopamine agonists have been traditionally associated with impulse control disorder development in Parkinson's disease, the role of antidepressant in this context has been less explored. A study published in the American Journal of Geriatric Psychiatry examined the association between antidepressant use and development of impulse control disorder in patients with Parkinson's disease, using data from Parkinson's Progression Markers Initiative. The researcher conducted a retrospective analysis of 1,450 Parkinson's disease patients. They found that serotonergic antidepressant use was significantly associated with increased risk of developing impulse control disorder, even after adjusting for non-risk factors such as dopamine agonist use, depression, using disease duration, sex, and age. Specifically, antidepressant use was associated with 40% increased hazards of impulse control disorder and nearly double the odds in mixed effects model. This is quite important. We never thought of that. We normally give antidepressant for impulse control disorder. To put these findings into perspective, among the study participants, 10% had an ICD at baseline and 27% developed ICD at some point during the study. Antidepressants were prescribed to 39% of patients during the study period. Notably, patients using antidepressants were more likely to develop ICD compared to those not using them, 39% versus 20%. The study findings are significant as they suggest that antidepressants, particularly serotonergic ones, may play a role in the development of ICD in BD patients. This association was previously underestimated. The authors propose that neurobiological mechanism underlying antidepressant-induced mania in bipolar disorder may be similar to those involved in ICD development in Parkinson's. They emphasize the need for personalized treatment strategies and careful consideration when prescribing antidepressant to Parkinson's disease patients, especially those already at high risk of impulse control disorder. The study also highlights the potential of using non-serotonergic antidepressant like bupropion as an alternative high-risk cases, although further research is needed. So this is, I think, a very interesting development in the field. There is a new study about vesicular monoamine transporter T, which is VMAT2 inhibitors, show promise as antipsychotic with the potential for lower tardive dyskinesia. As you know, that VMAT2 inhibitors have emerged as a promising class of medication for treating various neurological and psychiatric disorders. The drugs work by reducing a presynaptic release of monoamine like dopamine, potentially offer a novel approach to managing conditions such as schizophrenia and psychosis. This meta-analysis and systematic review examined the efficacy and safety of vesicular monoamine transporters inhibitors, especially tetrabenazine and deutetrabenazine and valbenazine in treating schizophrenia and psychosis. The researchers conducted comprehensive database search and identified 4,892 records, of which 5 studies including 173 participants, met the criteria for meta-analysis. The results suggest that VMAT2 inhibitors were more effective than placebo for slight improvement in psychotic symptoms, but not for moderate improvement when compared to active. So it has an antipsychotic effect, not only for tardive dyskinesia, although it's not big effect. VMT2 inhibitors show promise with potential to lower tardive dyskinesia. This study also included the narrative review of 37 additional studies that did not meet meta-analysis criteria. These studies, spanning over 60 years, provided further evidence for potential antipsychotic effect of VMAT2 inhibitors, particularly tetrabenazine. However, the authors noted significant limitation in the quality and methodology of many older studies. The review suggests that VMT2 inhibitors may offer antipsychotic efficacy with potential lower risk of tardive dyskinesia and dopamine receptor supersensitivity compared to the traditional antipsychotics. Authors conclude that VMTA inhibitors show promise. More rigorous modern clinical trials are needed to definitely establish their efficacy and safety profile in treating psychosis. Another interesting research about cognitive behavioral therapy that normalize frontoparietal brain activation in pediatric anxiety disorder. Anxiety disorders are common in children and adolescents, often causing significant impairment in daily functioning. Cognitive behavioral therapy is considered as first-line treatment for pediatric anxiety, but its neural mechanism of action are not fully understood. Investigating the brain changes associated with successful treatment can provide valuable insight into how CBT works and can potentially lead to more targeted intervention. A study examined the neural mechanism associated with symptom change following cognitive behavioral therapy in unmedicated pediatric patients with anxiety disorder. Using functional MRI, the researcher compared the brain activation pattern during a threat processing task before and after 12 weeks of CBT in 69 anxious youth and in 62 healthy control scanned at similar intervals. The key findings of this study: before treatment, anxious youth showed hyperactivation in frontoparietal attention network and limbic region compared to control. After CBT, frontoparietal hyperactivation normalized to levels similar to controls, while the limbic, especially amygdala, activation remained elevated. Reaction times to the task also improved in anxious group after treatment. In a separate sample at risk youth not receiving treatment, anxiety-related neural differences remained stable over time, suggesting that changes in the treated group were likely due to CBT effects rather than just the passage of time. Another interesting study about omega-3 supplementation that reduced schizotypal traits in children. You all will know that schizotypal trait is quite difficult to manage. Schizotypal personality traits in children have been associated with increased risk of developing schizophrenia spectrum disorder later in life, or as you know, schizotypal personality now in ICD-11 is a schizotypal disorder, which is part of psychotic disorder, is removed from personality disorder, but it is still a personality disorder in DSM-5. Nutritional interventions, particularly omega-3 fatty acid supplementation, have shown promise in reducing symptoms of schizophrenia and related conditions in various studies. Randomized controlled trials examined the effects of omega-3 supplementation in schizotypal personality traits in 290 children aged 11 to 12 years. Participants were divided into 4 groups: omega-3 only, cognitive behavioral therapy only, omega-3 زائد CBT, and control. The study found that 3 months of omega-3 supplementation result in significant short-term reduction in total schizotype B scores, particularly for interpersonal features with effects persisting up to 9 months post-treatment in the interpersonal factor. Omega-3 alone and omega-3 plus CBT groups showed the most substantial reduction in schizotypal score. Interesting. Omega-3, to continue, importantly, dietary intake of omega-3 moderated treatment outcome with schizotype B reduction from omega-3 supplementation, most evident with those with higher dietary omega-3 intake. The study suggests that omega-3 supplementation may be promising intervention for reducing schizotypal traits in children, potentially offering a way to decrease the risk of developing more severe schizophrenia spectrum disorder later in life. And the authors noted that longer-term studies with higher doses of omega-3 and larger sample size are needed to validate these findings. Okay, moving to another paper, and very interesting paper. It reveals an increased bleeding risk with combined USSRI and anticoagulant. This is a warning you always know about. If with SSRI there is a talk about the effect of oral anticoagulant, but we don't really have that much of studies to elaborate on this. But in this study, SSRIs and oral anticoagulants are widely used medications that can independently increase the risk of bleeding. The combined use of these drugs, especially in patients with atrial fibrillation, has raised concern about elevated risk of major bleeding events. A study published in JAMA Network Open aimed to clarify the bleeding risk associated with concomitant use of SSRI and oral anticoagulant compared to oral anticoagulant alone. The study utilized a large population-based nested case control design, drawing data from UK Clinical Practice Research Data Link. It included over 331,000 patients with atrial fibrillation who initiated oral anticoagulant therapy. The findings revealed a 33% increased risk of major bleeding with combined use of SSRI and oral anticoagulant compared to anticoagulant alone. The risk was particularly pronounced in the first 30 days of combined use and remained elevated up to 6 months. The increased risk was consistent across the different patients' demographics and types of oral anticoagulant, including both direct oral anticoagulant and vitamin D antagonist. The study highlighted that the risk of major bleeding was significant for intracranial hemorrhage gastrointestinal bleeding, and other major bleeding types. Despite the increased risk, the study does not suggest discontinuing either medication, but emphasizes the importance of close monitoring, especially during the initial months of combined therapy. The research underscores the need for healthcare providers to consider individual risk factors and possibly prefer the DOC over VKS when SSRI are prescribed, due to their lower potential for pharmacokinetic interaction. طبعا يعني الفكرة بأنه عدد كبير من المرضى بياخذوا أنتي كواجولانت، وإحنا بندخل أحيانا بحيرة، وأحيانا أطباء القلب ما يقولوا للمريض أوقف الأنتي ديبريسن. يعني إحنا للأسف لو ما بيكون في تعاون مع طبيب القلب ممكن التفاهم على أنه يصير في مونيتورينج. هو في قاعدة أساسا طبية معروفة، وهي أن يعني أي مريض على أنتي كواجولانت بلافيكس وغيرها لابد في البداية عند إدخال أي دواء إن نشوف ال INR more frequently. We may have to reduce the anticoagulant effect or increase it when combining with other drug. In this case, with SSRI, we may have to decrease the dose. Another important research that long-term methylphenidate treatment shows minimal impact on sleep in children with ADHD. Sleep difficulties are a common issue among children and adolescents with ADHD. The study, part of 2 years attention deficit hyperactivity disorder drug-used chronic effects project, investigating the long-term effects of methylphenidate on sleep in children and adolescents with ADHD. The researchers compared 3 groups: children with ADHD taking methylphenidate, children with ADHD not taking medication, children without ADHD. Using children's sleep habits questionnaire, they found that both ADHD groups had clinically significant sleep problem at baseline, while the control group did not. So, surprisingly, over 2 years, the methylphenidate group showed no worsening of sleep pattern and even reported improvement in total sleep score, bedtime resistance, and parasomnia score. Compared with methylphenidate group to the non-medicated ADHD group, there were no significant difference in changes to total sleep score, bedtime resistance, or parasomnia. However, methylphenidate group showed more significant improvement in sleep delay and in sleep duration subscale at 6, 12, and 24 months. These findings suggest that long-term methylphenidate treatment does not negatively affect sleep in children and adolescents with ADHD and may even improve certain aspects of sleep. The study emphasized the importance of continued monitoring of sleep-related issues in ADHD patients undergoing treatment. Another interesting study about high dietary sugar intake linked to increased depression risk in USA adult. I think this is one of the very interesting studies. Always people talk about sugar as bad thing, but without specificity. Depression is a significant public health concern affecting approximately 4.4% of the global population, with projection indicating that it could become leading contributor to the world health disease burden by 2030. A cross-sectional study investigated the association between dietary sugar intake and depression in U.S. adults using data from National Health Nutrition Examination Survey 2011-2018. هذه 2016 is the reference. The researchers analyzed data from 18,000 adults aged 20 years and older, assessing depressive symptoms using the patient's health questionnaire, PHQ-9, and dietary sugar intake through 24-hour dietary recalls. After adjusting for various confounding factors, the study found significant positive association between dietary sugar intake and depression. Specifically, for every 100 gram per day increase in dietary intake, there was 28% higher prevalence in depression. I think this is quite important. And the researchers suggest that several potential mechanisms of this association, including the impact of sugar on neurotransmitter production, inflammation, and gut microbiota. However, they acknowledge the limitation of the cross-sectional design, which cannot establish causality. The study concludes that higher dietary sugar intake in American adults is positively related to higher prevalence of depression, but further research is needed to explore the underlying mechanism and potential benefit of controlling dietary sugar in intake in patients with depression. Another paper with interesting study, caffeine intake linked to increased anxiety risk, meta-analysis. We always talk about the effect of the caffeine, but this is a very important study. It's a meta-analysis published in Frontier in Psychology, examining the relationship between caffeine intake and anxiety in healthy individuals without psychiatric disorder. The researchers analyzed data from 8 studies involving 546 participants. The study found that caffeine consumption was significantly associated with increased risk of anxiety compared to controlled group. The effects were dose-dependent, with low-dose caffeine, less than 400 milligrams, moderately increasing anxiety risk, and while in high intake over 400 milligrams led to much more significant increased anxiety risk. This is, I have just seen a patient this evening. He is actually suffering from generalized anxiety and panic disorder. He takes around 2.5 grams of caffeine daily. So he is in caffeine toxicity all the time. The researchers suggest that caffeine anxiogenic effect may be due to its interaction with the adenosine receptors in the brain, which can influence the neurotransmitter activity and physiological response like increased heart rate. Based on these findings, the author recommend that caffeine intake in healthy population should not exceed 400 milligrams daily to minimize anxiety risk. However, they note that some limitation, including high heterogeneity between studies and the need for further research on dose-response relationship and potential confounding factors. I think this is quite important in clinical practice. Other news that came up this year, treatment of schizophrenia has historically relied on D2 receptor blockade. Still, a new era of non-D2 targets agents is emerging with a muscarinic receptor modulation, showing promise as effective and well-tolerated alternative approach. A phase 2 trial of M4 orthostatic agonist NB1-11175868 shows positive result. This is another ذكرناه كوبينيفاي بيشتغل على M1 and 4 and but this another one works on M4 only. Another important news, draft guidelines from FDA integrating the randomized controlled trials for drugs and bipolar products into routine clinical practice. Propose streamlining protocols for drug and biologic trials, focusing on key data collection to facilitate research within standard clinical practice. يعني this advice is quite important لأنه مرات كثير in clinical practice we don't actually collect all the information that will be needed later on in any study. And another relevant news, the CDC اللي هو Center for Disease Control in the United States has issued a healthy advisory warning about disrupted access to prescription stimulant for ADHD patients following a fraud indictment against a major telehealth company, which coincide with ongoing medication shortages. This disruption raises concern about increased overdose risk due to the potential use of counterfeit pills, promoting health care providers and public health professionals to take preventive measures and educate patients about the dangers of obtaining medication from unregulated source. يعني الواقع إنه هاي فيها تحذير شديد لمشكلة التيلي هيلث ووصف الستيمولان عبرها وما حصل في الولايات المتحدة من انتشار بعض الستيمولانتس اللي هي كاونترفيت يعني مزورة أدت إلى وفيات. كان هناك هذا التحذير. هذه المراجع لكل الأشياء اللي ذكرت ويمكن الرجوع إلها. شكرا جزيلا لإصغائكم وآسف على الإطالة. نفتح المجال لأي تعليق. تفضل دكتور سداد.
شكرا جزيلا دكتور وليد. بالحقيقة عرض شامل للبحوث اللي حدثت في 2024 بالنسبة للطب النفسي. أحسنت، بارك الله فيك. بس عندي تعليق واحد على كوبينيفاي اللي هو كما تعلم أنه موجود فقط في الولايات المتحدة الأمريكية. طبعا السعر مع كوبينيفاي اللي انتقدوه الكثير أنه هو $1850 لعلاج شهر واحد فقط. يعني هذا السعر بالحقيقة خيالي، يعني إذا قارناه بالكثير من العقاقير الموجودة وخاصة الجي ال بي 1 اللي متوفرة في كل مكان هذه الأيام لعلاج البدانة. النقطة الأخرى على بريستول مايرز سكويب، يعني الشركة، العجيب أنه الكثير أصابه بالدهشة أنه الدواء تم الموافقة عليه من ال FDA، رغم أنه في الحقيقة يعني تمت الموافقة من خلال دراسة يعني 2 clinical trials لمدة 5 أسابيع فقط. يعني فلذلك اكو بعض يعني خاصة في أوروبا وحتى في أمريكا ينتقدون هذا، أنه هذا بسرعة جدا، خاصة أنه كما نعلم أنه schizophrenia is a chronic illness. What happens after 3 months 4 months 6 months. لحد الآن المتحدث أتصور سمعت قبل فترة أن المتحدث مع بريستول مايرز سكويب لا يزال يتحدث أنه في يعني التقديم للموافقة على يعني تسويق العقار في أوروبا، ده يفكر فيه. بس اللي يعرفه أنه هناك يعني دبل كلينيكال يعني دبل بلايند كلينيكال ترايل راح تحدث في بريطانيا هذا العام، لأنه كما تعلم بريطانيا منفصلة عن أوروبا حاليا. لأن كنا في السابق مثلا العقار إذا يوافق عليه في أوروبا يتم الموافقة عليه أوتوماتيكيا في بريطانيا. بس في نفس الوقت يعني it is an exciting news بالحقيقة for schizophrenia. كما تعلم أنه this is the most يعني important illness really اللي يواجه جميع السايكايترست في جميع أنحاء العالم. وشكرا جزيلا على هذا العرض الشامل بالحقيقة لقضايا معينة، خصوصا قضية الSSRIs اليوز الامبلس كنترول في الالدرلي. يعني هي في النقطة كانت موجودة بس ما ينتبه لها الكثيرين. يعني هسه حاليا اكو ستدي يعني انه واحد has to be careful when prescribing these drugs. ما فقط تعطيه العقار، you have to follow up the patient every 2 weeks at least for a period of time وmake sure انه there is no frontal lobe involvement. شكرا جزيلا دكتور وليد، بارك الله فيك. يعني فالمحاضرة بالحقيقة كانت جدا شيقة وفي مكانها في اليوم الثاني من كانون الثاني 2025. شكرا جزيلا.
شكرا دكتور سداد. الحقيقة أنا أتفق معك تماما في موضوع الكوبينيفاي والطريقة اللي يعني أدخل فيها. أنا ما أجده مثير للاهتمام إن إحنا بدأنا نشهد مرحلة جديدة
نعم
من في الأدوية اللي هي لا علاقة لها بالدوبامين. يعني
نعم
كما تعلم إحنا عندنا كلوزابين من سنوات طويلة لا يعمل على الدوبامين،
نعم
ومع ذلك أصرينا نرجع للدوبامين وأتيبيكال ولسه يشتغل على الدوبامين. فبالحقيقة دخول ال NMDA والجلوتاميت والكولينرجيك، أنا لا أعتقد أنه هذا الدواء يعني سيكون له أثر سحري، إلا
نعم
أنه هو مبشر بأننا إحنا على مشارف فترة يكون فيها مجال واسع لأدوية جديدة تعمل بشكل مختلف عن
نعم
الدوبامين، وقد تعطينا نتائج أفضل. وهذا الحقيقة شيء نأمل دائما أن يكون هو المنطق. هلا كما تعلم يعني ال FDA ليس غريب عليها أنه فيها كوربشن وفيها فساد، وموثق من أيام البروزك.
نعم
ولجنة اللي ترأسها مونتغومري تعلم كيف يعني كيف نزل البروزك بدون وصفة في الولايات
نعم
المتحدة، وهذا مستحيل يحصل في أي بلد أوروبي. على كل الأحوال يعني الشيء مهم. أنا أعتقد أنه في هذه يعني دراسات كثيرة يعني في كل يوم. الآن أنا قبل ما أبدأ في 14 دراسة في الأمريكان جورنال على السايكوديليكس بس، يعني
نعم
عدد جانيوري فيرست اوف جانيوري كله سايكوديليكس، يعني وكأن الطب كله خلص انتهى واحنا الآن بس عندنا سايكوديليكس.
نعم
فأحيانا يعني الأسلوب الأمريكي مستفز شوي في
صحيح
طريقة يعني فعليا وكأن السايكوديليكس. هلا في شيء طبعا حضرتك عارفه الزملاء، انه في الولايات المتحدة الموضوع بزنس. يعني اذا الشركات اللي بتصنع هذه الاشياء بتعمل سبورت لدراسات كثيرة، ف it's very likely انها تاخذ approval which is not the case in Europe.
صحيح
بس it's interesting انه ال FDA approved a drug by طلع من الصين، ريسبردال
نعم
لونج اكتنج. واز يو نو لحد الان في ادويه اللي مثلا زي كلوبيكسول وفلوبنتكسول، كلوبنتكسول وفلوبنتكسول لانها دنماركيه لغايه
نعم
الان امريكا مش سامحه تدخل، مش معترفه فيها.
نعم
ولما نزل السيبراليكس ما اعترفوا فيه الا لما اخذ شركه امريكيه وسمى وصار دواء أمريكي ساعتها بيبدأ التاريخ. لما يحكوا عن الاس ار اي بيتكلموا عن الاس ار اي كأول واحد. احنا الزميليدين أول واحد،
نعم.
وانسحب في أوائل الثمانينات، ثم جاء اللي بعده فلوفوكسامين، بس كلاهما مش من أمريكا،
لا
بالتالي لم يحسبوا في حسابات أمريكا.
لا لا تبدأ شفاش. صحيح.
دكتور جلال تفضل.
شكرا جزيلا دكتور وليد. يعني جميل جدا اتعرف على هذول الشغلات. انا بالحقيقه عم فكر بالاوميجا 3، يعني الماوس اللي يمكن النسختين او الثلاثه اللي قبل الحاليه وحتى الحاليه عم تعطي دائما انه ما في اي شيء يدل على فائده الاوميجا 3 لا بالسايكوتيك سيمبتومز ديسوردرز ولا بالدبريشن، رغم انه كان ترند بفتره من الفترات انه عطوا اوميجا 3، وحتى يعني انه تركيب هيك دهنيات الدماغ. فحاليا بالسكيزوتايبل نحن في عندنا يعني anxiety component قد يكون التاثير عليه ما وضح، يعني ما انا ما شفت وين التاثير بالسكيزوتايبل.
مش معروف
مش
التأثير، مش معروف صراحة. من أين هو يعني ما هو الميكانيزم. لكن
مم.
الانترستينج انه اساسا ما عندنا دراسات على السكيزوتايبال تريتس ان تشيلدرن لاي
مم.
شيء اخر سوى يعني سايكوثيرابي، اما لاي ادويه عاده ما في. فهو this is interesting. هلا هو الاوميجا 3، ويمكن دكتور سداد كتب عنه. اوميجا 3 هلا هو acceptable انه يستعمل في الديسليبيديميا، يعني
مم.
لأي طبيب قلب يعني قد يكون لجوء الأول قبل الستاتينز للأوميجا 3 أو كلاهما معا. الشيء الثاني أنه في بعض الأمور مثل استعماله، يعني مثلا استعماله في الأوتيزم يستعمل بلا أي دراسة ولا أي مبرر. تجد
مم.
الناس تكتب تعطي أوميجا 3 يعني هيك بشكل عشوائي. آه، أنا بشعر دائما في interesting finding بتظهر في كثير من الابيديميولوجيكال ستاديز بين الدول البحرية والغير بحرية.
مم.
يعني لما ترجع لدراسة ال World Wide Depression، كانت سجلت أعتقد هونغ كونغ أو إحدى دول جنوب شرق آسيا، اللي هي مشمسة طول السنة وتأكل السي فود هو الأساس. كان فيها وقتها الدبريشن 1 بوينت أو 0.07، مقارنة في بعض الدول الإسكندنافية وبعض الدول اللي بعيدة عن البحار. الإسكندنافية اللي فيها الشمس، والبعيدة عن البحار اللي أكل المأكولات البحرية فيها قليل. وكانت النتائج مذهلة، اللي الفروق بكم تأثير الشمس وتأثير المأكولات البحرية. فأنا أعتقد أنه هي منطقة، يعني دور الغذاء في العلاج في الطب عموما وفي الطب النفسي خصوصا دور يجب أن يستمر بالبحث يعني وعدم الإهمال. يعني للأسف مثلا كثير من الناس، يعني أنا عندي الكثير من المرضى اللي من دول الخليج العربي، يعني اللي هم محاطين بالبحار، لا يأكلوا الأسماك، لا يأكلوا يعني ممكن هو على البحر بيفطر وبتعشى وبتغدى كبسة. وانت يا دكتور ريال عملت في السعودية، أظن تعرف هذا جيدا، ما بتشوفهم بياكلوا سمك. وكثير من المرضى الآن بدأوا يأكلوا السمك بعد يعني الإصرار عليهم أن يأكلوا سمك. ففعليا من المؤكد أن النيوتريشن له دور في السايكولوجيكال تشينجز، لكن الريسيرش فيه لا زال غير كافي.
نعم.
وهذه
هو
يعني
هو
بالانترستنج في هذه الدراسة، انه في لما بتطلع دراسة على موضوع زي هذا تحفز باقي الباحثين اللي بيدوروا على مواضيع بيبحثوا وبتعطي توصيات، ولما بتقرأ البيبر كاملة تعطي زي يعني توجيه للآخرين كيف يمكن أن يستفيدوا من هذا البحث
تماما.
ويجربوا بحوث أخرى. إن شاء الله في
تمام.
2025 تظهر هذه البحوث.
انا بس عندي ملاحظه انه الاقتصار على الاوميجا 3 رغم انه الفارق بين الاغذيه البحريه والاغذيه الناس اللي ما بياكلوا اغذيه بحريه هو بالميكروبيوم، واللي الميكروبيوم صار يعني في رابط، يعني كثير دراسات عليه، فربما يكون الامر بمحل ثاني لما بنحكي عن نوتريشن. بس على
هلا
الاوميجا
احنا
3 تحديدا.
الميكروبيوم موضوع ضخم، وانا عملت عليه محاضرة موجودة اعتقد على اليوتيوب. الميكروبيوم قصته بصراحة يثير اهتمام كبير، وهناك يعني آمال واضحة إنه الميكروبيوم قد يلعب دورا مهما في موضوع العلاج في المنتال إلنس وغيره. والميكروبيوم حتى نقول إنه يعني سيلعب هذا الدور يحتاج إلى تفصيل. يعني معظم الدراسات حتى الآن في الميكروبيوم عموميا لم تخصص أنواع من الميكروبيوم نشوف تأثيره على الانكزايتي أو على الدبريشن أو غيره. فهو برضو الميكروبيوم أنا بعتقد إنه راح يكون له حصة من البحث القادم. والبيبرز، كمية البيبرز على الميكروبيوم هائلة اللي تظهر، ويعني انترستنج انك تشوفها.
يعني يمكن في واحده من الدراسات عم تحكي انه اذا في اثنين في علاقه حميمه بينهم، بغض النظر عن الاكل المشترك بيناتهم، بس انه في هيك على مستوى المشاعر والتواصل، فانه اذا في اكثر من 3 سنين تبدا تغيرات في الميكروبيوم، فيعني امر كثير مهم. لذلك انه قد يكون فعلا لما نحكي عن نوتريشن بالنسبه للاغذيه البحريه بيطلع معنا شيء ثاني، بس الاوميجا 3 حصروا بالاوميجا 3 وعدم تحديد شو هي اللي تغير بالتايبال تريت بالاطفال، بتصور بيطرح كثير من الاسئله على الموضوع.
بس أنا بوعدك نعمل محاضرة عن الأوميجا 3، يمكن الدكتور سداد شايفه مبسوط عليها. ففي خلال 2025 لازم نتطرق لنعمل جرد للأوميجا
إن
3
شاء
صحيح.
الله. مم.
شكرا جزيلا. أي تعليقات أخرى أو أسئلة من الزملاء؟
دكتور وليد،
تفضل دكتور.
تحياتي وشكرا جزيلا على الابديتد ريسيرش، يعني انفورميشن اللي تفضلت فيها. كل عام وانتم بخير للجميع. الحقيقة أنا عندي يعني نقطتين. النقطة الأولى إنه إحنا في خلال عملنا بنستخدم السايكو إدوكيشن للبيشنتس وللفاميليز وللكيررز. يعني بالنسبة للأوبيزيتي أو الويت كين in schizophrenia, it's unlikely to use another agent to fight this kind of metabolic problem. We depend on physical exercises. Sometimes even we will register the patients in gym activity to ensure that they will have more physical activity and to control their weight. The education is very important in aspect like this. Metformin, for example, in diabetic patients, they have been reported that it's used in schizophrenia to control the weight. But I'm quite sure people who take the metformin, they are complaining of adverse effects of the medication. So we will add more side effects into it. Unfortunately, the system, the American system, the other day I have seen a patient coming from the US, and they have 6, 7 medication for schizophrenia. And I was inquiring about it. One of them is tenormin. Tenormin is beta blocker.
and they are using it for the increase of heart rate in schizophrenia. So instead of focusing on the illness or the disorder, they are trying to focus on symptomatology and use as much as they can of pharmacological agents to control this symptomatology. The sugar intake, for example, as you mentioned, it's extremely important, and I think there is some subcultural element into that. For example, in Europe, it's unlikely to see people in general using that quantity of sugar, comparing with, for example, in our countries, in Jordan or in the Middle East. So I think we need to have to address this problem in terms of also psychoeducation to the public to reduce the amount of sugar used to control the mood in depression. But thank you very much for all the information you have mentioned about.
شكرا جزيلا دكتور أمين. شكرا لكم جميعا. هذا اللقاء الأول في عام 25، وإن شاء الله لنا لقاءات قادمة. تصبحون على خير.
مع السلامة.